All right, well, we've done a number of different videos of day in the life, whether it be a day in the life of a BHC or a day in the life of a director. Over the next couple of days, we're going to try to give a day in the life of a healthcare consultant. So Bridget and I are actually in a small town, Libby, Montana. We've got some consulting over the next couple of days. So we're going to try to record some videos and give some insights about just what a 48-hour stretch of a healthcare consultant working with a primary care group on integrating behaviorally trained providers within their system. So hope we enjoy it, and we're excited to have you join us for the next 48 hours. All right, welcome to the beginning of the first day of consulting with Bridget and I. So it is early in the morning. One of the things that's a little bit tough when you're a consultant, and particularly when you're traveling throughout the country and potentially throughout the world, is this time zones. The one good thing for this trip is that we were able to drive. It was to Montana. It's only an hour difference. So we generally, just even throughout our day jobs, when we're in the state of Washington, we try to keep East Coast time, just so that helps us with consulting and be able to get up in the morning. And then when we travel throughout the country, we don't hit the time zones as bad, or it doesn't hit us as bad, and we're able to keep up with the things. The other thing that is a little bit unique is that, Bridget and I, we're not full-time consultants, right? So we also are BHCs, we're directors, and when we're consulting, we also are trying to keep up on those jobs. So part of this morning for me is going to be what I do every morning, which is complete my journal, complete my high performance planner. That's what I'm about to start on right now. And then I'm going to finish my notes from my visits that I saw yesterday, check some emails. We had a really incredible day at Community Health of Central Washington as far as visits and number of handoffs. I'm going to send an email out to the team just updating people on the great things that people have done and the progress that the team has made. And then I'm going to start to transition into some of the formal consulting stuff. So that's when I'll pick you all back up, is when we start to make that transition back to the formal consulting and fill you in what we're working on. All right, till then. Okay, so got done with the work that I had for CHCW, getting the notes done, sending out some emails, responding to some emails. So now it's time to transition into the formal consulting work. So, for those that are interested in consulting, the first thing that I would always encourage people to do is kind of ask, why are you interested in consulting? I remember first hearing about, consultants, and obviously having our mentors be, Kirk and Patty and Jeff. It's like, man, it just seems cool, right? It just seems like a lot of fun. And while potentially a good reason to get into it, there's also needs to be a why that is going into it. One of the things that Bridget and I have found is that consulting with organizations allows an impact into a system that can be far-reaching. And I think that's an important thing to think about when you're going into consulting. What impact are you hoping to have? And also, when you're working with organizations, that's a very important question to ask, because sometimes organizations might reach out to you and just ask, hey, we want you to do some consulting. It's like kind of free. Maybe they got a grant. And then the question becomes, it's like, but what are we hoping to get out of this? What is the impact going to be? Because one of the things that I have found, at least, is that any consulting work that just seems like I'm doing it for the sake of the consulting or the sake of getting paid, it just doesn't seem fun. But consulting work that is rooted in, hey, this is going to help transform a system, this is help getting more patients into the healthcare system, it's something that is going to be useful for the community. It's like, I can get down with that. So if you are considering doing consulting and different things, just make sure there's a why, similar to what we always talk about in patient care and working in healthcare. There needs to be a why that's guiding your work. So couple different tips about when you're a consultant and you're on the road. The one thing, as I already mentioned in the first part of the video, was keep your routine as much as possible. Try to wake up the same time that you normally do. One of the things that Bridget and I was hoping to do this morning was to work out. Unfortunately, the hotel that we're staying at doesn't have a gym, so we're going to be intentional on making sure that we take walks and move our bodies a lot. Being on the road, it also means that you got to be intentional with the foods that you eat. Bridget and I didn't do the best of that yesterday, so we're going to try to do a little bit better today, and just making sure that you're getting sleep. Being on the road in hotels are difficult to do. The other thing that I would really encourage people, if you're thinking about consulting and you're going to be on the road a lot, is to think about your workspace. So one of the things that I'll show you right now is that I have a portable dual monitor. If you are someone that uses dual monitors, and I would definitely encourage people to, if you're not, is you need to figure out a way to keep that going on the road. Because if you get used to working in a dual monitor, or maybe 3 monitors when you're at home or in your work office, but then you go on the road and you don't have those monitors, it can get a little bit unwieldy. The other thing to just highlight that we'll be showing throughout the day is that there's different types of consulting projects that Bridget and I work on. We do a lot of distal and virtual, and those are done through like webinar series, and they might be on specific topics to help upskill behavioral health providers as far as working within primary care topics like how do you work with chronic pain and how do you work with smoking cessation or different things that might be coming through, and still also making sure that we're coming from that contextual approach and approach for high quality primary care. Today and tomorrow's consulting is going to be specific on the ground. And it's kind of like almost like a traditional consulting where we go in, we're going to meet with the executive team in the morning. We're then going to shadow some of the BHCs and also the medical providers just to learn their systems, see how people operate. And then in the afternoon, we're going to have a really fun opportunity to actually give a training to multiple different disciplines that are there. There's going to be support staff. There's going to be medical providers. There's going to be BHCs that are there. And as a consultant, that's a really great thing because so often you go in and it's like, hey, we need to work with the BHCs, which is true. That's going to be the majority of the work as far as upskilling them. As you all know, though, if you're working within PCBH, we know it's a system change. So getting some time with the providers, getting some time with the support staff, and having it be as a group so everybody's hearing the same message and be able to ask questions with each other can be a very, very important thing. One of the things I'm very grateful for the system that we're working in is that it's really tough, and it's a community health center, this center that we're working with, it's really tough to pull all those individuals out to do a 4-hour training. So Bridget and I are very fortunate that we're going to be able to do this today as far as give a 4-hour training on all things related to PCBH. So then tomorrow is going to be the same 4-hour presentation just with a different group. So we hit all of the team members over the next 2 days. And then in the afternoon, we'll finish out doing a little bit more shadowing and giving feedback. That is going to transition then into us looping back into the executive team and just saying, hey, what might be some additional training both for the BHCs and for maybe the medical team that really might help make PCBH flourish. I'll end with this because my mind could talk a lot about just different aspects with consulting. One of the things that I've struggled with, and Bridget's been really good at helping me, is that you want to make everything change immediately, right? We one of the things that's almost kind of like we want to take our system at CHCW and then make it happen in the other systems by just doing like a 2-day training. We know that's not going to happen, right? And so one of the most important things I think as a consultant is to think back to that book, The Gap versus the Gain. While there might be a lot of gaps still to work, that it's like, hey, we're still progressing towards this high fidelity to PCBH and to get a lot of community members in and provide them contextual and compassionate care, there might be a lot of a big gap between us getting to where we want to be. Consulting, though, is really about turning around and thinking about the gains. What are the gains that we're making? And working with directors on that and making sure that, hey, even if we got still room to go, we want to make sure that we're noticing the gains. And one of the things that Bridget and I always ask ourselves when we're consulting is, if today, if at the end of the training, it was a success, what would that be? Now, we can't say that, over these next 2-day training, that the success would be that it's the highest fidelity PCBH program in the country. Like, that is unrealistic. So asking yourself when you're doing consulting, particularly at the end of a day, it's like, what would be a success today? What would make sure that if I'm leaving, I'm driving back home to Yakima, what would be the things that I would really want to make sure the team is taken away, that maybe is a 1-degree change, almost like what we do with patients, that is moving the ship in the direction that what we want to. It might not be at the destination, but at least it's moving that way, and it's going to get there sooner than what it was before we came. So we'll be checking in throughout the day, but just some tips and tricks, and we'll give some other feedback, and I'm sure Bridget's going to be on some of these videos talking to you about her experience as well.
All right, so remember how we said we weren't able to work out and we needed to get our exercise. We found out that the clinic is a 22-minute walk away from our hotel as we pass a car. And
the loudest car. It's because it's not, it's a bus.
Is it a bus?
It's a school bus.
And it is cold in Montana, but that's okay.
That's
okay.
What gloves are for.
That is right. Did Dave wear gloves? He did not. But just another reminder of consulting life that you got to find ways to move your body and keep active. So we're heading into the clinic right now. The first part is going to be an hour or 2 meeting with the executive team. Bridget and I this morning already went over some talking points that we want to make sure that we have data on and to work with the executive team on, and keeping that question kind of apparent. It's like, would be a success from this? What would, if we knew this intervention or this consulting was helpful, what would be the result of that?
I'm not gonna lie, I like to walk.
I tell
This
you,
has been a highlight.
I tell you what, and we got to talk about a lot of different things, so it's just walking in general for the win. But all right, we'll sign off here because my hand's about to freeze off, but we will catch up with you all throughout the day. Okay, so I wish we were hoping to give more updates throughout. It's actually lunchtime right now. So really cool morning that we had. The first 2 hours were spent talking to the executive team, including the chief executive officer, the director of behavioral health, as well as some other key members of the team, such as the director of the medical providers and overseeing them and of risk. Really great conversation. One of the things I always love about these conversations is that the more you get people into a room that are seen at high level, you get to really talk about the different nuances of what might be stunting or growing the PCBH department. And you get to talk about different maybe training ideas, both for the BHCs and for the staff members. It's a really, really enriching conversation. As a consultant, you're almost like thinking about it as from like a patient perspective. You're just trying to gather as much information as possible and having that contextual lens still on, that everything makes sense, right? Every behavior, whether it be a BHC not doing what we want the BHC to or medical provider not, there's a reason, there's a context for us to really be curious about what's going on with that. And then we got to spend 2 hours with an awesome BHC shadowing them, seeing them with patient, getting handoffs, being able to provide feedback of what's going well, and talking about this different, some of the confusions and some of the things that kind of worry us a little bit about the BHC work, or not worries wouldn't be the right word, but just it's a little bit tough to grasp about how to go about it, talking about the schedules and different things. It was really great. Now we are to do a 4-hour presentation that's going to be like the greatest hits of all things related to PCBH and why behaviorally trained providers can do wonderful things within primary care and really get people excited about the work. So we'll check back in maybe at the break and maybe when we're walking back, but it's been a good morning so far. I'm hyped. I'm hyped right now about what this clinic is doing. All right, well, that was the end of day one with consulting. Bridget and I just got done with a 4-hour training with the staff, which was really cool that we got everybody, MAs, PCPs, BHCs, case managers. It was a really cool thing.
Yeah, we had a lot of fun, and we really highlighted the overall mission and the goal behind integration in the first place. And the cool thing about this place is that they are already doing a bunch of mental health support. And so really getting a more structure is going to be really beneficial.
And I would say maybe the best answer, I feel like, anybody's ever getting about how to introduce a BHC.
How to get a BHC into the room.
This one MA literally nailed every single thing that she does as far as like saying that it's a team member, it's an expert.
They're going to come help you with your stress levels.
It was incredible, which I think is always an important thing with consulting work. Well, there might be some different things that we want to improve on and definitely do better. There's a lot of things that are happening that are good.
Yeah.
And to really make people feel like the work is meaningful and it's making a difference. So Bridget and I, we're gonna do another walk because we walked here, right? And hopefully it's not too cold. We're gonna get some food, debrief, and then we'll catch you all up later on. Okay, it is early in the morning. You can see my Amazon Music Prime that's going. We got some Christmas tunes that are going on, holiday music. So it's early morning. We're about to start the second day, and one of the things I'm doing now is just writing up a little bit of a summary, and then also suggestions for future considerations for the organization to uptake or to implement regarding the goals within their primary care behavioral health program. So I think an important nugget as a consultant, and one that I've struggled with, is that especially at the beginning, I always approached these consulting contracts that I knew best, right? I'm a consultant. I oversee a successful, program, and this is what we do, and let's just replicate what we do within the system. The problem with that, though, is that my system, or any system, is relevant to that system, right? We have policies, we have procedures, we have patient populations. We have so many different contextual factors that kind of shift what we do and why we do what we do. So for other health systems, that might not be the same way. So it's been a challenge for me, because again, I'm a diehard, as you all know, I'm a diehard PCBHer, and I want everybody to do PCBH in a way that has high fidelity. With other systems, though, that might not be their approach. That might not be what they're hoping to do. And so one of the things that Bridget and I have worked very hard on is working with, executive leaderships to define those goals and those whys and those values,
Then also giving them kind of options to consider. So one of the things that I'm writing up right now is this idea. It's like, hey, if we go full PCBH, we're trying to do high fidelity PCBH, this is what I recommend. If we're going to try to keep like a hybrid system, these are some of the things that we would recommend. And regardless of the approach, here are some different suggestions that we would indicate, such as, no matter what you do, I think a single session mindset would be great. I think contextualism would be great, regardless if you're doing full PCBH or a hybrid approach. So as a consultant, really making sure that while you might have a bias, which I definitely do, towards PCBH and contextualism and different things, really trying to make sure you're working with the organization to make sure they're getting their needs met, while still being a consultant and trying to give your expertise on why this might not be a good thing or some barriers that people might not be seeing, still giving options for the team to consider. So that's what I'm doing right now, is writing that up. I'm sure Bridget's going to be on a video here shortly, but yeah, we'll touch base soon. All right, so we just finished up the first 4-hour training on Friday. Another one that was a repeat of what we did yesterday, but we did sneak in how to love your craft without losing your mind, which
Yes, we did.
Yeah,
Yeah,
like it went over.
and even if you are doing the same presentation, it's going to have a life of its own, because you're interacting. Well, you should be interacting with the audience and seeing what it is that they want to talk about. So it takes a little bit of a different flavor. So it's that fine line of the art of it, where you are going to be, you should have all of your materials very well organized and planned, but at the same time, you need to know your material well enough to where you can ad lib and riff a little bit and then get back to the material.
I love that you said that, because we've been trying to give like tips and tricks to consultants throughout this. And
I noticed that.
If you're a consultant that is doing a lot of trainings, and like we just had to do back to back, I love what you just said there, where you have to know the material so much, but still be a human. And that's what we just had 2 people say to us, is that they love the genuineness and the authenticity that came through. And that can only come through, 1, if we actually believe the stuff that we're talking about, and then 2, if we knew the stuff that we were talking about.
That's true.
Yeah. So I think, another reminder of, if you get hit up for some certain consulting jobs, be careful about what saying yes to, just because, 1, you want it to be genuine, right? You don't want to be brought into a thing. It's like, oh, tell me about, I don't know, testing. For us, we'd be like, no, we're not going to do that, because that's not something we know.
I don't know enough about it.
Have genuineness about. Yeah. I'm trying to think of any other tips coming from this afternoon. We're going to be meeting with, shadowing some of the MAs and the PCPs, and we're going to be meeting for an exit kind of interview. Anything that you'd like to do during the exit?
I was going to say that's going to be a big piece of really just kind of summarizing and putting a bow on what's been accomplished, and then really looking to those next actionable steps.
Yes.
And it is going to be a collaborative process, but you better be ready, I think, as a consultant, to be able to provide clear next steps, but also be flexible enough to where if they can't do that because of finances or resources or time or whatever, that, it's not only your plan and your suggestion. You have to be able, in our opinion, to be able to adapt to it.
What's so interesting is that shooting these videos and I'm so glad we did this day in the life, is that I've compared it to so much our clinical work, right?
I know, there's a lot of parallels.
We need to be ready for kind of action items and plans and evidence-based things and suggestions, and we can't just do those indiscriminately. We got to work within the system and see what their context is.
And needing to be real and knowing what the audience wants as well. And yeah, it's always, you're always nervous when you're giving these presentations, because you don't know how many other presentations or how many other people have been brought in. And so to have 2 people say, hey, thank you for your realness, and I wasn't bored. And out of all the other presentations, like somebody told us yesterday that they were falling asleep at the previous, and I joked and said, that's half the goal, is having people not fall asleep. I was kind of joking, but also a little bit serious.
I agree. Well, I love it. We'll maybe touch base at the end of the day as we wrap up and we head back to Yakima, but almost completing the 48 hours with Beachy Bauman Consulting and the day in the life. All right.
Buddy.
All right, well,
here we go.
We just wrapped up the final meeting with the executive team, giving some feedback and some potential additional. It was fun. I got to shadow an MA throughout the process, and just really great work about how every single person and part of the team delivers high quality primary care. And Bridge, you got to shadow a BHC?
Yep, I got to see a great, very typical visit of dealing with some mental behavioral health, some family dynamic stuff. Whatever you would think that you'd see, and the patient was so gracious, allowing me to sit in. It was awesome.
So we are now heading back. This is Consulting Life, right? You're going to drive in the snow, and that's what we got coming forward. So we're going to be heading back to Yakima, about a 6-hour drive. But thanks for spending 48 hours with us as consultants. All right, bye.